Welcome to our podcast, Neurons, Clay, and Canvas, How Art Therapy Heals. We're thrilled to have you join us today as we dive into the colorful world of art therapy, a fascinating way to help individuals heal through creativity.
That's right. Art therapy is not just about filling canvases with paint or molding clay. It's a serious mental health profession that uses the process of creating art within a therapeutic relationship to foster change in mood, behavior, and even identity. Sounds intriguing, doesn't it? But how does it actually work?
Great question. You see, art therapy is particularly powerful when working with conditions that make it hard for individuals to express themselves verbally. This includes complex trauma, depression, and even neurodegenerative illnesses. Art becomes a bridge, connecting emotions and thoughts that might be too fragmented for words.
Exactly. In this episode, we'll explore how art literally talks to our brains, bodies, and relationships. Starting off, let's talk about the brain. Because art therapy is a brain-based practice, it taps into sensory, motor, visual, emotional, and cognitive systems all at once.
Research shows that engaging in art, like drawing or sculpting with clay, can alter brainwave patterns. There are studies using neuroimaging and EEG technology that reveal how these artistic activities support emotional engagement and regulation. It's almost like giving the brain a workout, right?
Yes, and here's an exciting fact. Creative processes can actually enhance neuroplasticity. That's a fancy term that means the brain's ability to form new connections. This is especially crucial for individuals who have experienced trauma or suffer from mood disorders. Art therapy can help repair those damaged circuits in the brain.
What a wonderful concept. Now let's transition to how these creative processes lead to change. In art therapy, we engage in activities that might seem simple, such as pounding clay or sweeping broad strokes of paint. These kinesthetic and sensory actions can help release built-up tension, kind of like a stress valve opening up.
Yes, and clients often find these activities to be self-soothing. For instance, those who might feel highly agitated or aroused can calm their nervous systems through these engaging actions. But that's not the only approach. There's also perceptual work using colors and shapes, which helps folks name and manage their feelings.
And let's not forget the cognitive symbolic work, where participants can create images, sequences, or even comic strips. This allows individuals to weave their traumatic experiences into coherent narratives, which is often paired with cognitive restructuring. It's like putting together the pieces of a jigsaw puzzle rather than keeping them scattered in disarray.
To illustrate this better, let's talk about some clients, like children with trauma who use bilateral drawing or clay activities to engage with their body memories. This technique helps them connect and process difficult feelings that may have been locked away.
And for adults, let's consider those living with Parkinson's disease. They may participate in structured clay groups, and research shows they often experience reduced depression and stress, along with improved posture and overall mood during these activities. It's incredible how the creative process can lead to such meaningful outcomes.
Now let's take a quick pause to try a guided mini practice for our listeners at home. We'll call this exercise Material Match. Are you ready to explore your emotional state through materials?
Absolutely. Here's what you can do. Gather or simply imagine 3 materials. You want to think of something soft and malleable, like clay or dough, something fluid, like watercolor, and finally something controlled, like a fine pen.
Great setup. Now ask yourself, which material feels like it fits your current emotional state? Do you feel restless, shut down, or perhaps overwhelmed?
Once you've identified that, take about 2 minutes, either in real life or just in your mind. Play with the material you've chosen. Notice what it does to your breath, how it feels in your muscles, and what thoughts come to mind.
And then, if you're up for it, switch it up. If you began with something that felt tight and controlled, try something looser this time. If you started with chaos, contrast that by using a more structured material. Just notice the difference in how your nervous system responds to these materials.
That's a perfect reflection exercise. And here's the key takeaway, folks. Different materials evoke different responses within our nervous systems, and skilled art therapists choose and sequence these intentionally to support emotional regulation and expression.
The insight here is that you can notice your own preferences with these materials and discuss them with a therapist as an integral part of your collaborative treatment planning.
Now, for those listeners who are considering art therapy for themselves or someone they care about, let's take some time to discuss when and how to seek out this type of treatment.
Art therapy is recommended for a variety of conditions, like depression, trauma-related issues, or medical illnesses that carry a psychological impact. It can be especially helpful for children who struggle to express their feelings verbally.
When seeking art therapy, it's essential to engage with a qualified and registered art therapist. Their practice should be trauma-informed, integrating current knowledge about attachment, neuroscience, and importantly, respecting culture and identity.
And don't hesitate to clarify your goals when you first meet with a therapist. It's also about how this therapy can fit into the bigger picture of your mental health treatment. Think about integrating art therapy with modalities like cognitive behavioral therapy, narrative therapy, or psychodynamic approaches.
What an enriching discussion we've had today. We explored how art therapy engages with the brain and body, the various pathways of change through creative expression, and even practiced a reflective exercise. It's clear that art therapy is a dynamic and powerful tool for healing.
Indeed. Remember, whether you're a parent, a caregiver, or someone considering therapy for yourself, art therapy can be a valuable addition to your mental health toolkit. Thank you for tuning in to Neurons, Clay, and Canvas. We hope you found today's episode enlightening and that it inspires you to explore the healing potential of art.
We'll be back next time with more insights into the fascinating world of art and mental health. Until then, keep creating.